Hi, Mitch here, retired pharmacist with another video on preventive health and treatment. This time I decided to talk about a common chronic infection that affects about 10% of the U.S. population, mostly in patients over the age of 60. Onychomycosis is a scientific word for nail fungus. Onycho is nail, mycosis is fungus. This infection causes discoloration, thickening, and separation from the nail bed in both toenails and fingernails. This change in the appearance of the nails sometimes causes pain, but not in all patients. The main fungi are called dermatophytes, which makes up 90% of cases. Yeast and molds can also play a role in this problem. The problem is the dermatophytes get between the toenail or fingernail under the nail bed. This happens when there's a break in the nail. Onychomycosis is difficult to treat because of the slow growth of the nail, which, if intact, would probably not have been affected. The intact nail acts as a barrier against the elements like heat, moisture, and the fungi itself, which allow the dermatophytes to multiply and consume the keratin of the nail. Contributing factors to this infection are poor peripheral circulation, diabetes, repeated nail trauma, as seen in the construction and nail salon businesses. When the dermatophytes consume the keratin of the nail, the color turns brown and the nail becomes brittle. Now we need to talk about the treatments for onychomycosis, the side effects, dosage, interactions, and possible adverse effects. The two main medications for onychomycosis are oral, meaning by mouth, Lamisil, terbinafine, and Sporanox, Onychomycosis. Penlac nail lacquer, cycloporax 8% topical, is also used, but less effective than the oral medications. Side effects of both Lamisil and Sporanox are headache, rash, and stomach upset. Oral antifungals are, as a general rule, tend to have drug interactions, which increase or decrease the levels of other prescription medications. Which means you need to tell your physician or pharmacist what you're taking before taking these medications. Rare complications have been seen with Lamisil and Sporanox, like bile obstruction, itching, jaundice, and blood dyscrasias. This can be avoided by having your physician do liver enzyme levels and complete blood counts be obtained before treatment and repeated every 4 to 6 weeks during treatment. The dose of Lamisil is 250 milligrams per day for 12 weeks for toenail infections and 6 weeks for fingernail infections. The main reason is circulation is better in the fingernails than the toenails. The dose of Sporanox is 200 milligrams once daily, taken for 12 weeks for toenail and 6 weeks for fingernail infections. There's a treatment called the pulse treatment. This is only used for fingernail infections, which is 200 milligrams twice a day for a week per month, repeated every 2 weeks. So you're only taking it for 1 week per month, repeated every 2 to 3 months. Liver enzyme levels are indicated before treatment and every 4 to 6 weeks during treatment. This medication is not recommended for congestive heart failure patients. Fluconazole is another one, the other name for it is diflucan, is another effective oral antifungal, but is not currently labeled by the FDA for treatment of onychomycosis. Penlac nail lacquer, which is cycloporax 8%, is a topical antifungal nail lacquer that can take up to 6 months to a year before you notice your nails are improving in appearance. This problem is the infection is under the nail in the bed, and if you remove the nail, it's more exposed to moisture and heat, which does not solve the problem. Apply with provided applicator brush on the infected nails once daily, usually before bedtime. Where possible, apply to the underneath side of the nail if you can get in there. Allow to dry for at least 1 minute before putting on socks or stockings. After application, no showering for at least 8 hours due to moisture and heat, which makes it grow more. Apply Penlac daily over previous coats. Once a week, remove previous coats with alcohol. The majority of antifungal creams, which you have a tendency to see in the pharmacy, which don't work, are ineffective for onychomycosis because the problem is under the nail, not on the skin. Antifungal creams can be effective between the toes and surrounding skin only. This is all I have for today. I hope you enjoyed the content and will give me a thumbs up and subscribe to my channel for more preventive health education. Mitch, the retired pharmacist, signing out.